Yeah. And then of course, even in this system that we are talking about, you can have metastatic tumors. You can have a tumor, for example, or a cancer in the in the lymphoid tissue. That is, for example, in the lymph node or in the spleen or any other lymphoid organ. But it is because of metastasis. That is basically a tumor that came from elsewhere. Most of these metastatic tumors in this lymphoid tissue, mostly they tend to be carcinomas and melanoma. Yeah. Melanoma is basically a cancer that originates, and it's a malignant cancer that originates from melanocytes. Remember, we talked about the skin cells called melanocytes. Those are the ones that give us the skin mutation. So they become malignant, and we have melanoma. Look at this when we come to the skin as part of when we talk about more about melanoma. So there could be mainly carcinomas and melanomas. A common cancers metastatic to bone will have, for example, we have the one that will go to bone and affect the bone marrow will be mostly from the lungs, from the breast, from the prostate, from the kidney, from the thyroid. So these are major cancers that can easily spread to the bone marrow. And so when you do a bone marrow aspirate and look at them and examine them, you realize this could be from the lung or breast. So these are the main cancers that can affect the bone, from the lung, lung cancer, breast cancer, prostate cancer, kidney, the cancer of the kidney, thyroid cancer. Those are the ones that easily metastasize to bone and affect the bone marrow. And we say bone marrow is one of the major lymphoid tissue. Bone marrow is a common site for blood-borne metastasis of certain malignant tumors. So bone marrow mainly is a common site, blood-borne, that is taken by blood. It could even come from the GIT or any other system through blood. So it's blood, most of the time it's blood-borne. So from the lung, mostly tend to go by hematogenous means to the bone. Likewise from those other organs that we mentioned there. So this one leads to destruction of trabecular bone, leading to osteolytic deposits which appear as loosened areas on X-ray. So most of these, they go into bone and tend to destroy bone. That's what we talk about osteolytic, that is the bone destruction. So bone is destroyed in most of them. So if you do an X-ray, you do what we call radiolucent areas. Yeah, radiolucent areas compared to the normal appearance of bone. Yeah. And then, so carcinomas of the prostate often stimulates the active formation of new woven bone, producing osteosclerotic deposits, which appear as increased areas of bone density on X-rays. We call it osteosclerosis. So unlike, you remember one of the things that will metastasize to bone was prostate, but unlike the others, mostly for bone, it tends to, for prostate cancer, it tends to stimulate formation of new bone. So you are likely to have osteoblastic deposits, osteosclerotic. So actually that bone is likely to be more radiodense, even compared to, instead of it being osteolytic, it tends to become osteosclerotic. So that is a carcinoma that is from the prostate. Yeah, so one of the things that is unique about the prostate, which has been prostate tumor or cancer that has metastasized to the bone, is that it tends to cause osteosclerosis. Yeah, as opposed to osteolytic in many other of the tumors from other areas. So generally, metastatic tumors, when they're widespread, they may be associated with hypercalcemia because there is destruction of bone, and so there is a lot of release of calcium that is usually found in bone. Finally, we want to look at there's what we call extramedullary hematopoiesis. So when you talk of extramedullary hematopoiesis, you are talking about formation of blood cells outside the bone marrow. Remember, most of our red blood cells should be produced in the bone marrow. But if you have a problem with the bone marrow, maybe it is suppressed for one reason or the other, one of the response of the body would be to try and make blood outside the bone marrow. That's what we mean by extramedullary hematopoiesis. So response to bone marrow replacement or need for increased hematopoiesis. So if the bone marrow is suppressed or is replaced, completely destroyed, because of need for increased hematopoiesis, the other parts of the body, there are some parts of the body that can take over and start producing actually blood cells. And primarily it will be in the spleen or in the liver. So those are the ones that can start producing. Yeah. So other organs of lymphoreticular system reacquire their fetal potential for hematopoiesis. So most of these during fetal growth, there are other organs, including the spleen, that actually can produce blood cells. So the body, when there is replacement of the bone marrow or the suppression of the bone marrow, it will tend to cause the other organs, the lymphoreticular organ, to require their fetal potential for hematopoiesis until they start producing. So in this case, especially the spleen, if you have extramedullary hematopoiesis that is occurring in the spleen, it may lead to an enlarged spleen, a greatly enlarged spleen. We call it splenomegaly. So of course, there are very many other causes of spleen becoming enlarged, including frequent, infection by malaria and other parasites may cause the spleen to become enlarged. Of course, if there is tumor deposits or in the spleen, it can also become enlarged. If we have a lymphoma within the spleen, it can become enlarged. So there are still many other causes of enlarged spleen.